Good afternoon, everyone. I'm Mark Dexter Emas, and this is the presentation of Group 1. We are going to discuss about the tissue damage and inflammation. So, to begin the discussion, Nicole Miraflor will answer and discuss the first question.
The first question is, what is the function of inflammatory response? So first, let us know what is inflammation. Inflammation is the response that occurs when the tissues are damaged. Although many agents cause injuries such as microorganisms, cold, heat, radiant energy, chemicals, electricity, and mechanical trauma, the inflammatory response to all of them are similar. Inflammatory response is a dense mechanism that mobilizes the body's immune system to isolate and destroy microorganisms and other injurious agents. It can also remove foreign materials and damaged cells, and it allows tissue repair to occur. Sometimes the inflammatory response lasts longer or more intense than desirable, and the patient is given drugs to suppress the symptoms, like the antihistamine block the effect of histamine. Aspirin prevents the synthesis of prostaglandins, and cortisone reduces the release of several chemical mediators that cause inflammation. But still, the inflammatory response itself may not be enough to fight the effects of injury or fight off an infection, and the patient may require antibiotics. The second one will be discussed by Alyssa Cameron and Ira Otohot.
Based on my research, this is the following benefits of the 5 manifestations of inflammation. First is the heat or calor. It has been demonstrated that heat exposure has a significant effect on the cardiovascular and thermoregulatory systems. The body can better regulate body temperature as a result of heat adaptation, which keeps you cooler when exercising. The second, pain or dolor. There are numerous advantages of herbal tea for pain management. For example, peppermint has been used to reduce pain and decrease inflammation. And the third one is loss of function or functiolasa. A loss function evaluates the accuracy with which your prediction model can forecast the desired result or value. The learning problem is transformed into an optimization problem. A loss function is defined, and the algorithm is then optimized to minimize the loss function.
Redness rubor. Give relief in case of arthritis, rheumatism, gout and osteoarthritis, lower back pain and muscular pain. And the last one is swelling tumor. A growing body of evidence suggests that the host microbiota influence of tumor development across a range malignancies and previously thought to be completely sterile tumor include of microbiota and that bacteria. Community link to primary tumor maintain that link of distance metastasis sites.
Repair involves restoring the structure and function of injured tissues, whereas regeneration is a type of healing in which new growth totally transforms damaged tissues into its pre-damaged state. This is the primary distinction between repair and regeneration. Repair and regeneration are two types of processes initiated after a tissue injury, reconstructing the damage. Repair is one of the tissue healing processes responsible for the healing major types of tissue injury. It restores both the structure and the function of tissue after injury. In addition, the two processes involved in repair are regeneration and replacement.
Regeneration causes the new growth of the tissue occurring to the profilation of the cells of the tissue. Moreover, it can restore minor tissue damages with no permanent damages remain. Therefore, regeneration alone can be considered as a process of tissue healing.
Now we will talk about the different type of cell, the labile cell, the stable cell, and the permanent cell. Before we discuss each one, let us take a brief look on the cell cycle. We will only talk about G0 phase and G1 phase. In the G0 phase, it is the resting phase. The cell is neither dividing nor preparing to divide. While in G1 phase, the cell is starting to grow. The labile cell. This cell never go in G0 phase and undergo a rapid G1 phase. It means this cell is never rest and continuously divide. The labile cell are only alive in short of period of time. In fact, it is only last 5 days. So the daughter cell became the very stem cell and continue dividing. The example of it are duct, bone marrow cell, and skin cell.
Stable cell or quiescent cell, found in G0 but not like the permanent cell. Stable cell can get simulated and move from G0 to G1. So they can divide under certain conditions such as hepatocyte or liver cell, lymphocyte, and proximal convoluted tubule of the kidney.
Permanent cell. The name already gives us a hint. Permanent cell remain in G0 phase and can't regenerate on its own. It regenerates from the stem cell. The example of it are neurons, cardiac muscle, and skeletal muscle.
Now, let's sum up the important facts of these cell types. Labile cell never go into G0 and they are rapidly dividing with a short G1 phase. Stable cell are in the middle and are usually in G0 but can enter G1 and divide if needed. Permanent cell. They are not able to regenerate on their own and they can regenerate from stem cell.
And the last one we'll go over is primary and secondary healing, as well as which is the best healing between the two. Primary wound healing, also known as primary intention wound healing, occurs when surgeons fix a wound with staples, sutures, or other wound closing techniques. The wound initially fills with blood and the clot develops during primary union. The clot compromises fibrin, a thread-like protein that ties the wound's borders together. The clot surface dries to create a scab, which closes the incision and helps to prevent infection.
On the other hand, secondary wound healing, also known as secondary intention wound healing, happens when a wound that cannot be patched results in significant tissue loss. In some circumstances, doctors will allow the wound to heal spontaneously. This is more likely for wounds with a rodent edge, cover uneven areas, or are on body surface, where movement makes a suture or other closure procedure impractical.
In conclusion, the better healing is by primary union, as it has a big advantage including the time of closure because it is shorter than the secondary union. It also reduces the risk of infection and has a low chance of leaving a scar. And this is our group presentation. Thank you so much for listening and have a great day.